Most women prepare for childbirth as the most important event. They are afraid, they read, they worry. But there's one problem. Childbirth is only a few hours, but a child is years of life. And the main question, why do we prepare for childbirth but don't prepare for the child?
Yeah, it is. It's a profound shift in perspective right from the jump.
It really is. I mean, it completely forces you to evaluate where you're actually putting your energy.
Right. And it's something that so many expecting parents struggle with.
Exactly. And so, welcome to today's deep dive. If you are listening to this right now, you're probably navigating the absolute avalanche of information that comes with expecting a baby.
Oh, the avalanche is real. It's overwhelming.
Yeah, and our mission today is to kind of shift that mindset. We want to move away from obsessing over the finish line of pregnancy and focus on preparing for the absolute marathon of raising a child.
Which is really where the focus should be.
Right. Because you spend 9 months with an obstetrician preparing for essentially a one-day medical event. But you spend almost zero time with the pediatrician, the person who will actually guide you through the next 2 decades.
It's totally backward when you think about it.
It is. And the insights we're looking at today come from a fascinating translated video featuring a pediatric expert. So we are getting a completely different lens here. This is a pediatrician's perspective rather than an obstetrician's.
Yeah, which changes everything.
Okay, let's unpack this. We have to start by dismantling why we focus on the wrong things in the first place.
Well, according to the source, it comes down to culturally ingrained avoidance. In many cultures, there's this unspoken rule that you shouldn't jinx a pregnancy by preparing too early.
Oh, right. Like the superstition of setting up a nursery too soon.
Exactly. Parents actively avoid setting up the physical or logistical realities of a baby. Leaning into the medical preparation for labor feels like the only, safe way to channel all that anxiety without supposedly jinxing things.
Wow. Yeah. And the source uses a goldfish analogy that I think just illustrates this perfectly.
It's a great analogy.
It really is. So imagine walking into a pet store, buying a goldfish, and carrying it home in one of those little half-liter plastic bags.
Right, filled with water.
Yeah. And you walk into your house, you set the bag on the counter, and only at that exact moment do you start wondering, where an aquarium should go, or what kind of water it needs, or how to even feed the thing.
Which sounds completely absurd.
Completely absurd. But it's standard operating procedure for having a baby. It's like spending a year obsessing over the catering for your wedding, but never having a single conversation about how to actually be married.
Oh, that's spot on. You plan the party, but ignore the partnership.
Exactly.
What's fascinating here is how the structure of our healthcare system actually reinforces that goldfish jar mentality.
How so? Like mechanically?
Yeah, mechanically. Think about prenatal care. For 9 months, your primary point of contact is an OB/GYN. Now, an OB/GYN is fundamentally a surgeon. They are a specialist in maternal health.
Right.
Their whole biological and professional metric for success is managing the mother's health and executing a safe delivery. The moment that baby is safely out, their primary job is effectively complete.
Wow, yeah. And meanwhile, the pediatrician, the person whose literal job description is keeping that human alive and thriving for the next 18 years, they're basically a ghost during those 9 months.
A total ghost.
Yeah.
Which is a critical structural flaw, because those 9 months of gestation, they're a gift of time.
Right.
They're biologically built-in months meant for asking questions, for setting up the aquarium, so to speak. But because pregnant women are only funneled toward the OB/GYN, they spend that whole time waiting in fear of the delivery process instead of actively preparing for the child.
Okay, so that raises a very practical question for anyone listening. If waiting until the baby is handed to you in the recovery room is the wrong time to meet your pediatrician,
Which it is.
what exactly should you be doing with them beforehand? And the source lays out a very specific pre-birth checklist, right?
It does. And the very first thing on that list is vaccinations. Specifically, having a real discussion about the hepatitis B shot.
Right, because that's usually given right away.
Exactly. Hepatitis B is a viral infection that attacks the liver, and it's transmitted through bodily fluids. Since the birth process involves, a massive exchange of fluids.
Yeah, naturally.
And because a newborn's immune system is highly naive, this vaccine is typically administered within the first few hours of life. It prompts early antibody production.
But the issue the source highlights here isn't just about the biology of the vaccine, right? It's about the cognitive load of making that decision.
Yes, the timing is everything.
Because the scenario described in the video is a nurse walking into your recovery room with a consent form on a clipboard right after you've given birth.
Right.
You're exhausted, your hormone levels are absolutely crashing, and you might even be under the influence of strong painkillers.
And according to the pediatrician, that is literally the worst possible environment for medical decision-making.
I can imagine.
The goal is to sit down with a pediatrician in month 7 or 8 of the pregnancy.
Yeah.
That's when you actually have the cognitive bandwidth.
Yeah, to ask real questions.
Right. You ask how the vaccine functions, what specific brands or formulations are available at your regional hospital, what the clinical recommendations are. You make a deliberate, informed choice while you're calm.
So by the time that nurse walks in post-delivery, the decision is already made. It's integrated into your birth plan.
Exactly.
Mm-hmm.
But there's a catch. Deciding on a vaccine brand at month 8 doesn't do you any good if you don't actually have the authority to enforce it in the hospital room.
Oh, the legal aspect.
Yes. The source points out a major vulnerability here. Parents often don't realize they have the legal right to pause medical interventions.
That's a crucial point for the listener, because hospitals operate on these highly standardized, super efficient routines.
They're machines, basically.
Yeah, and when you're swept up in that machinery, it feels natural to just, comply with whatever is happening to your baby.
Right. You assume it's just mandatory. But the video is very firm on this legal threshold. A mother needs to transition her mindset from being a passive patient to being an active parent before she even steps foot in the maternity ward.
So establishing early on that no treatment can be given to your child without parental legal consent.
Exactly. No medical treatment, whether it's a blood draw, a vitamin K shot, or a topical ointment, can be legally administered to a minor without parental consent.
Okay, so having that foundational knowledge just gives you the confidence to say, I understand what you're offering, but I need a moment to review this.
Precisely. And this naturally extends to the logistics of what happens after the medical checks are done.
Oh, like feeding and the whole rooming in debate.
Yeah. The source addresses the immediate post-birth environment. And society right now really pushes this heavy narrative that a mother must have the baby in the room with her for constant skin-to-skin contact. And that, utilizing the hospital nursery so the mother can just get some sleep is somehow a failure of early bonding.
Wait, so is it actually a failure if a mother chooses the nursery option just to sleep? Because society really pushes constant contact, like heavily.
Not at all. And the pediatrician actually challenges this entirely by framing it around maternal biology. It's about the genetics of lactation.
Okay, I want to pause there because connecting genetics to whether you send your baby to the nursery for a few hours is, it's a bit of a leap. How does that biological mechanism actually work?
It comes down to the heritability of glandular tissue and prolactin receptors. Prolactin is the hormone primarily responsible for milk production.
Okay.
And the density of those receptors in your breast tissue and how robustly your body responds to the initial hormone drop after the placenta is delivered, that has a very strong genetic component.
Oh, interesting.
Yeah. The source suggests looking at your maternal history. So did your own mother breastfeed for a long time? If she easily produced milk and breastfed you and your siblings without issue, you likely inherited a biological framework with a high density of those receptors.
So if you have that specific genetic framework, how does that actually change your strategy in the hospital?
Well, it provides a biological buffer. Let's say you endure a grueling 20-hour labor.
Sounds exhausting.
Right. Your body is in a severe physical deficit. Your primary medical need at that moment is sleep. Because your genetic predisposition for lactation is strong, the source argues you can safely utilize the hospital nursery for a few hours of recovery without critically derailing your milk supply.
Oh, wow. That removes so much guilt.
It does. However, if your family history is characterized by low milk supply, your genetic framework might require intense, frequent stimulation.
So that's when you would need the constant physical contact of rooming in.
Exactly. You might need that to effectively trigger those prolactin receptors, regardless of your exhaustion level.
So it validates both choices based on the mother's genetic predispositions and exhaustion levels. That makes it deeply personal and data-driven.
Completely reframes it.
Yeah. But beyond just where the baby sleeps, we also need to look at the physical room itself. Because the literal physical environment of the hospital is something parents blindly accept, often to the detriment of the child's comfort.
Oh, the environmental conditions, yes.
Yes.
The numbers presented here are alarming.
They really are. The pediatrician points out that hospitals are routinely keeping maternity rooms at 30 degrees Celsius, which, for anyone using Fahrenheit, is 86 degrees.
It's sweltering.
And it's usually paired with a suffocating humidity level hovering around 20%. And the source argues this is actively harmful to a healthy newborn. They say parents need to demand fresh air, not a sterile chamber.
Yes, it's a massive myth to bust. And the source labels this the premature baby rule mistake.
Right.
To understand why an 86-degree room is problematic, we have to look at how different infants generate heat. A premature infant lacks a fully developed nervous system.
Right.
And they don't have the physical mass to generate body heat. So for them, an external heat source, like a highly regulated incubator, is a strict biological necessity for survival.
Okay, wait, I'm stuck on this. If a full-term baby has been living inside a 98-degree womb for 9 straight months, wouldn't transitioning into an 86-degree hospital room actually feel cold to them? Like, why is the pediatrician saying this high heat is a mistake?
It's a really common question, but it conflates fluid dynamics with air dynamics.
Oh, I see.
The womb is a liquid environment where the mother's circulatory system is entirely regulating the core temperature. But once born into the air, a healthy full-term baby relies on a totally unique biological mechanism called brown fat.
Brown fat.
Yes, it's a specialized type of adipose tissue. It's concentrated mostly around their neck and back, and it's designed specifically to burn calories and generate massive amounts of internal heat.
So they basically have their own internal furnace running from the moment they're born.
Exactly. A full-term infant's biology expects to enter a cooler environment and is fully equipped to heat itself. But when hospital protocols apply that premature baby rule to a healthy infant,
They overheat them.
right, placing a baby with an active internal furnace into a dry, 86-degree room and then swaddling them in blankets, you short-circuit their natural biology.
And since newborns don't have fully functioning sweat glands, they can't effectively cool themselves down.
Exactly. They can't sweat efficiently to dissipate all that heat. So instead, they lose moisture rapidly through respiration. They're breathing heavily in dry air, which leads to an elevated risk of severe dehydration.
Here's where it gets really interesting. You know, we over-engineer safety with heat and sterilization, but we completely forget that human beings, even tiny ones, need basic, comfortable oxygen. There's that joke the source makes.
The restaurant joke.
Yeah. Why is it that every restaurant has functioning air conditioning, but you can rarely find it in a maternity ward?
It's a dark irony. But it highlights how blindly we accept these protocols.
But advocating for the thermostat or demanding a different vaccine protocol, it requires a level of mental fortitude that a lot of expecting parents just don't feel they have.
Right. It takes a toll.
And that brings us to the psychological state of the mother. Because all these physical and logistical preparations, they're useless if the mother's mental state is ruined by toxic societal pressures before she even reaches the hospital.
Absolutely. The psychological component is framed around what the source identifies as the heroism of childbirth complex.
Oh, this is such a big deal.
It really is. Society expects and almost demands that labor be a brutal, agonizing struggle.
Yeah. If a woman gives birth easily, like in an hour without immense suffering, she actually feels a complex of inadequacy.
She stays quiet about it.
Yeah, she stays quiet because society makes her feel like she didn't earn it. But if she suffers, she's treated as a hero and tells the world how awful it was.
Which means the only birth stories ever circulated loudly are the horror stories.
And if you're pregnant and listening to this, and you're terrified because people keep projecting their negative birth trauma onto you, you have to learn the vital life skill of ignoring fearmongers.
You must learn to physically turn away from them.
Exactly.
And if we connect this to the bigger picture, the pediatrician views this not just as a tool for a peaceful pregnancy. Setting these boundaries now is the very first step in learning how to filter out the relentless, unsolicited parenting advice you're going to get.
Oh, yeah. Even from well-meaning grandmothers.
For the next 18 years. If you can't stop a coworker from scaring you about childbirth, you won't be able to stop them from critiquing how you feed your toddler.
That is such a crucial mindset shift. And that leads us into 3 specific areas of practical health where societal expectations clash with medical reality during the 9 months. Let's start with partners in the delivery room.
This is a highly debated one.
Yeah, because current dogma says a supportive partner must be physically present, holding your hand, or they're failing. But the source says it's not a modern dogma or requirement.
Right, it depends entirely on the specific man and woman. The source pushes back by examining the hormonal reality of labor.
because the mechanics of labor rely on the mother's hormonal state.
Exactly. The biological driver of labor contractions is oxytocin. But oxytocin production is highly sensitive to adrenaline and cortisol stress hormones.
Right.
And some partners are just naturally highly anxious. When an anxious partner is in the room, their stress is palpable. They are radiating adrenaline.
And a laboring mother senses that panic, which triggers her own fight-or-flight response. Her adrenaline spikes, which inhibits the oxytocin, and that can literally stall the labor.
Exactly. So the source says there is zero shame in them waiting outside if they're too anxious. It's about biology, not a social test.
Okay, the second area is prenatal vitamins. Now, the WHO generally recommends getting nutrients from a diverse diet, but pregnancy is a high-risk time for deficiencies.
Yes, and here's the twist. The source introduces the concept of fetal parasitism.
Fetal parasitism, wow.
It sounds harsh, but biologically, the fetus acts like a parasite.
Yeah.
It will take what it needs from the mother's body, regardless of her intake.
Like with calcium, right.
Yes. If your diet is deficient in calcium, the fetus still demands it. So your body releases hormones to literally break down your own bone tissue. The calcium is leached from your skeleton to build the babies.
That is wild and slightly terrifying. So prenatal vitamins are often less about building the baby and more about ensuring the mother isn't left completely depleted.
Exactly. It's a defense mechanism for the mother.
Okay. And the final practical point is about dental and medical pain. There's this myth that pregnant women must suffer through things like toothaches without anesthesia.
The martyrdom myth.
Yeah, don't be a martyr to pain, because untreated pulsing pain and sleeplessness are far worse for the pregnancy than a safe OBGYN-approved anesthetic.
Right. If you're in agony, your bloodstream is flooded with stress hormones, which restricts blood flow to the placenta. It's demonstrably more dangerous.
So, what does this all mean? When you look at all of this, almost all of our anxieties stem from blindly following rules rather than asking basic questions tailored to our own bodies.
It really all routes back to reclaiming your agency during those 9 months.
Absolutely. So for you listening, here is the summary. Use your 9 months to set up the aquarium, not just to worry about carrying the jar home.
Yes.
Talk to a pediatrician early, manage your hospital environment, and ruthlessly protect your psychological peace.
I love that. And as we wrap up, I want to deliver a final thought from the source for the listener to ponder.
Go for it.
We spend so much time fearing the pain of birth because it's a specific, measurable event we think we can control. But what if our intense obsession with those few hours of labor is really just a psychological shield, a way to distract ourselves from the terrifying, unscripted reality that we are solely responsible for shaping a human life for the next 20 years?
Wow. That is definitely something to think about. Thank you for joining us on this deep dive. Keep questioning the consensus, and we will see you next time.